Thank you for your generous introduction. Friends, good morning. What I am going to be talking to you not going to be a technical subject because as I pointed out to you, Dr. Ajay Mahajan as well as Dr. Pahlajani has demonstrated to you how the various interventional procedures perform, the technicalities involved into that. What I'm going to talk to you, something on the lines of Dr. Supe told you. How do you build up your career? How do you become something in this world? People say that I have been successful. I don't want to judge myself. It is for the people to judge. But if they say so, I want you to use me as a guinea pig model to see how I have, Dr. Pahlajani has become successful. I'm saying this because when I entered into postgraduate studies, I looked back and I found that I had no gold medals. I was not amongst the top 5 students of my batch. I was an average student. I did have good intelligence, but I still can claim that I had greater sense of knowing what is good, what is bad, and what is futuristic. That sense I had better than those 5 students who were the toppers in my class. So it is for you people who could not make it to the top to understand. Of course it is also to the toppers, but people who are not toppers and then they get dejected that they have not been scholastically scholars, so therefore they have nothing else to do but to get into general practice or get into general medicine or general surgery and do run-of-the-mill things and not to be excellent in the profession that they could do it because they have basic understanding, basic intelligence, because anyone who gets into the medical college has got a basic intelligence. He's not a dud. But do they take up the opportunities, seek opportunities to excel in their life? And you use me what I am going to show you, and if you feel so, please build up your career on those lines, taking those challenges. When we see the journey of our career, our specialities, the first step is always we are in pursuit of our career. We keep on exploring. We keep on seeing what is good, what is bad for me, and keep on looking at the peers as well as our seniors, how they have excelled in their life, and try to see what is good for me. Then there are formative years. You pick up a specialty which you feel that you are going to be doing, so you start building up your career in that. Then you struggle because you want to become something, because you want to make do ends meet, you have to make the finances of the home good. So then you keep on struggling. You have to compete against your colleagues, your peers, and then you have to come up. Then comes the real crux. And I always say this, trading path. What path you should trade to become successful, different from your colleagues or even the toppers in your class. So you have to trade the path. That is the most important thing to be successful in your life. If you did not do this, everything else is useless. And then comes the success if you traded the right path. And then of course, once you come to my age, then we start looking back. Did I do the things which were right? Did I do something wrong? I was successful or was I not successful? Then, is there any therefore prescription for the career success? There are always, I feel, few factors which make you feel successful. Number one is the inheritance. You are born in the doctor's families. Your grandfather was doctor, your uncle was doctor. You inherit practice. How much does it contribute? We'll talk about it little later on. Then there are scholastic achievements. Are these scholastic achievements enough to make you successful in your career? And most important is, I always felt that to be in the right place at right time in the right company, and very, very important is opportunities of unknown. To take the path which is unknown, I think that's the most important point in being successful in your life. Now when I say inheritance, you have got classical examples of Michael Faraday. You know, Michael Faraday was born in a very, very poor family. He was given one loaf of bread every day to be consumed over next 7 days. He distributed or delivered newspapers. He worked in the bookbinder's shop until he got a job with Humphrey Davy. And that's where he made his career as a physicist as well as a chemist. Look at Charles Darwin. He was a medical student. His father was a surgeon in the Royal College of Surgeons, London. But he decided he's not going to abandon his medical studies, took up a boat along with his friends. He had no money, he borrowed the money, went on the boat, and then got an idea that something which is different what is being taught. That is the natural selection, survival of the species. I think that's where he propounded the theory of evolution. And then look at Albert Einstein. Albert Einstein could not find a job of a lecturer in the University of Zurich. And he used to work as kind of a clerk in the patent office in Switzerland. And then from there he grew, and then he got the Nobel Prize. And we all consider Albert Einstein as the world's most accomplished scientist in the centuries that have passed by. So I think I can just give you an example. You don't have to be brilliant to start with. Even if you are done, so-called done, I think you can make it big. Then that's what Albert Einstein says. Why? Because imagination is more important than knowledge. You may have knowledge, but until you can imagine, you can think beyond, think forward, think beyond what is being taught to you, you will never be successful. And look at what Robert Frost said. He says, two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. I think this is very true for me. Because this is where you come to the woods. There are two roads. On one road, everybody is going. There's somebody who's not treading the path. And that's what I say, treading the path which is less traveled. I think that will make all the difference in your life. You have to be adventurous, you have to take risks. And that's where we took the risk. And this is the picture of Werner Forssmann, who got the Nobel Prize for showing the world that the cardiac catheterization can be done. And he actually injected the material into his own basilic vein, would go into the screening room. It was totally banned in those days, but he took the risk. He was actually a urologist, but he showed that one can pass a catheter into the right atrium and inject the dyes, and as well as inject the drugs to treat a patient. And then came Dr. Mason Sones, who described the technique of coronary angiography. And that made all the difference in the lives of all of us. All of us. And what made the difference to us was the man on the right side, Dr. Andreas Grunzing, who told the world that coronary arteries need not be bypassed by surgery. You can do an angioplasty with a balloon. Everybody laughed at it. Everybody. As a matter of fact, when he sent a paper for presentation in Miami for the American Heart Association, paper was not accepted as a full presentation. It was accepted as a poster presentation. And there are several pictures of Dr. Grunzing trying to explain to the people who visited his stall for the poster, which was only for 1 hour, that what he did, that this angioplasty is a correct treatment and is going to be a more acceptable treatment for treating the obstructive coronary artery disease. He was my guest here in Bombay, and he told us that this is the technique which is going to be the technique of future. Now, I think that's where we all got the idea that what is the road which is not traveled. The road that was not traveled was the field of interventional cardiology. People were there in the city who were wearing three-piece suit, then they would go and see the patient, auscultate the patient, write down the drugs, and collect the fees. But for this, there were no fees, because you had to even learn the procedure, several years, needs a lot of hard work in the beginning. There were no balloons, there were no wires, there were no guiding catheters. You had to work with the very primitive devices, or very primitive hardware as we call it, to do a coronary angioplasty. But we never lost courage. So what he did, Dr. Andreas Grudzic today, no book of interventional cardiology is complete without mentioning Dr. Andreas Grudzic's name as a pioneer. So therefore, this is where we thought that we should do something which is different. And this is where I think the Sion Hospital's kind of great contribution to the field of cardiology in this country is. This is the place, this is the birthplace for the interventional cardiology for the entire country. And then, when we presented the papers, what we did, we were criticized very heavily into the scientific meetings. Everybody will say, how can you put in a balloon into somebody's coronary arteries? How can you do coronary angiography in a patient who has got an acute heart attack? We were criticized very badly because we always felt that there are cynics in this world. When you want to do something different, there are cynics in the world. And cynics, how do they behave? When an idea is conceived, he will say, it is not going to work. That's what his reaction is going to be. When it shows some results, he'll say, let's wait and watch. And when the idea works, his response is, so what is new in this? So this is how today everybody says interventional cardiology, coronary angioplasty, everybody says what is new in this. First, just imagine in the first line, when we were doing this, everybody said it's not going to work and people used to criticize. And then taking a challenge, on February 5, it's not 6, February 5, 1985, I had a patient referred by a colleague of mine who had an anterior infarction, 50 years man from Mulund, and he had a post-infarction angina. He came to us at Bridge Canyon Hospital. I had nothing, I had no balloons, I had no wires, I had no guiding catheters, very primitive equipment. But I requested a friend of mine from Philadelphia who was coming for a conference here to bring some catheters with him. And with the help of the catheters and with his help, we performed the first coronary angioplasty in the country, which has been recorded all along. So, after being an interventional cardiologist, what does it matter to me? What toll it takes and what does it give it to me? I think that's what I do, I must enjoy it. And I must also know how much toll it is going to take on my life. Why do I do an interventional cardiology? First of all, is it that for money I'm doing? Money one can earn anyway. You can do a non-invasive cardiology, you can do urology, you can do general practice, you can earn money. Money is not a matter. Is there glamour and prestige? Is there an excitement and thrill? Is there an alleviation of suffering? Or is there an innate attraction? I had all these remaining four because I thought that I must do something which has a glamour. People come and hang around me and ask me how I did the procedure. I think whatever, I don't want to be kind of a something to say I don't enjoy that. Somebody comes and appreciates what I'm doing, I certainly enjoy that. There's an excitement and thrill and elevation of suffering. When a patient comes to you with a heart attack, acute heart attack, you've got a total block in one of the artery, you take the patient to the cath lab within a few minutes, you restore the flow, patient becomes all right. I think that gives you inner satisfaction that you prevented somebody's major heart attack. And of course, as I said, I always wanted to do something which is different. I advise you people also to do something different than what a run-of-the-mill people are doing. And money? Yes, today, those days there was no money in the interventional cardiology. I used to be paid 500 rupees for doing an angioplasty. But today, an interventional cardiologist is very well rewarded. You can see on an average in USA, a interventional cardiologist makes close to $500,000. He's much more than surgeon, gastroenterologist, radiologist, orthopedic surgeon. So he earns much more than because we have settled or we have brought the interventional cardiology to a level where patients go and opt for getting an interventional procedure than surgery. And is there a thrill and excitement into this? So for example, you will see here an angiogram of a patient who has got an acute anterior wall infarction. You see his LAD is completely occluded here. We should be going down like this. He comes with the cath lab. Within few minutes, you take the patient to do an angiogram, and then you put in a wire, you put in a balloon, and you reestablish the flow. And then everybody claps and everybody says that, well, you saved somebody's heart. I think there's a tremendous sense of happiness. You have saved somebody's life. The family is grateful to you. So there's an excitement, thrill. But money apart, one should not look at the money factor when you are doing a procedure like this. Money comes automatically, as I showed you. It brings you a lot of money as compared to any other procedure. Or a patient like this who has got a left main obstruction, completely occluded left main artery here, which otherwise in the past would have gone for a coronary artery bypass surgery. But today you can put in a stent here and give a completely normal looking left main artery to the patient, and everybody says that yes, I mean, instead of cutting open the chest, you have done a procedure which is equivalent to or sometimes even better than surgery. Today, I'm sure Dr. Mahajan might have shown you, today we are able to do with this interventional cardiology, we are able to do percutaneous aortic valve, where you put in a catheter to the aorta, come down to the aortic valve, and inflate the valve and replace the valve here of a patient who has got an aortic stenosis. So interventional cardiology has progressed apart. Now, does this come with some price? Yes, it comes with a tremendous price, and that is a burnt out syndrome. We all get a burnt out syndrome, and the burnt out syndrome occurs because of the odd hours that we put in. There's a family life which gets suffered because many times you get a call in the middle of the night. You believe me, and you better believe my word. Even at this age, if I get a call in the middle of the night with a patient who got an infarction, I wake up, get into the car and go and do a primary angioplasty for a patient. Therefore, there's a tremendous stress on this, and there's a radiation hazard, because when you do primary angioplasty or you do a chronic total occlusion, a lot of amount of radiations, and because of that, wearing the heavy laid gown, one gets a back problem, and that leads to the burnt out syndrome. And what is the percentage of doctors who develop this burnt out syndrome? As a matter of fact, all doctors in general develop a burnt out syndrome. 46% of the cardiologists are down with the burnt out syndrome. And the degree of burnt out syndrome is one of the highest amongst the cardiologists. It is 4.29 out of a scale of 5. So we really get burnt out because of this tremendous stress. And females really get burnt out because of the childbearing. They have a lot of stress at home. They have got to do a lot of work at home. So that sort of really brings in the lot of burnt out syndrome amongst ladies. What about the cardiologists by age? I think most of us are burnt out by 46 to 55. I'm thankful that I'm still working today, but many of them get burnt out. By the age of 65, people get burnt out and they stop doing angioplasties. As a matter of fact, I published this editorial in the Indian Heart Journal, in which I had reported that there was a recent spurt of coronary disease, acute coronary disease among relatively young interventional cardiologists in India. I enrolled so many patients, especially from Bombay City, who had an acute coronary syndrome, either underwent angioplasty, bypass surgery, but some of them have died at a pretty young age because of the stress of interventional cardiology. As a matter of fact, there have been papers in which they have reported that when an interventional cardiologist performs a procedure, there's an increase in the heart rate during the procedure. All this comes with some negatives. And you might have, you're reading yesterday also, there's a big write-up about the stents in the newspapers. Today also there's a big write-up about the stents in the newspapers. And so much so, one magazine called all of us cardiologists as cardiac crooks. That we take sort of a put in unnecessary stents. I think a lot of adverse publicity, so we have to accept not only the hazards of doing a procedure, but also we have to accept the hazards of the media, the public, the legal system, and the politicians. And so what is a prescription for the, finally to speak to you, what's a prescription for being successful? I would say opportunities. First of all, you have to be at the right place, at the right time, in the right company to seize an opportunity. That is 4+ out of 5. And scholastic achievement, I will put lower. Because you may be scholastically scholar, but you may not get the right opportunities. I would say +3. And inheritance, very low. You can be born in a doctor's family, you do not pursue the right career, you can just be an ordinary doctor. But what most important with 5+ is the path least traded. You have to find out a path, be in the company of people who are providing you opportunities at the right time and the right company. That will give you totally about 9 points and you will be successful. And so what is my message? First of all, full commitment and be different. Don't be a run-of-the-mill doctor. Be different. Do not do what somebody else is doing. Do not copy me. Don't be a copycat. Then be adventurous and explore new paths. I think until unless you explore new paths, you will not be successful. Remember one thing, opportunities exist throughout our journey of life. They never cease. Just because you finish MBBS, you could not make it to top, doesn't matter. You did your post-graduation, couldn't make it to top, doesn't matter. Life is always full of opportunities. So always be on a lookout for opportunities, never give up and keep on fighting. However, also remember, there is no blind end of our journey in this world. And what is expected of you? I think this is one thing you people have to assure yourself, assure the community, assure your patient. And that is, remember one thing, patient is the king. You have to look after the patient's interest. You have to serve him because he is the king. There's nobody else who's going to make a decision in the treatment except the patient. And you have to therefore give him a total commitment and profession and be patient with him to give him the best of the treatment. And so I think, ladies and gentlemen, this is my prescription for you to be unique, be different, and progress in life by taking something totally extraordinary which nobody else is doing. So many times I'm asked the question, if I did not do, what I will be? What will I be? So I will show them this picture. You will get up in the morning, take your nice breakfast, go on the station, you will be huddled into the train. Like any other bird, then reach the destination of your work. And come back, sleep at home, have a nice dinner, and that's the job that you enjoy, but you never made it. You will not be something different, you will not be unique. So I think with this picture, you should know that you have to be different from people, different from what you would be in case you took the path which is well traded. Take a path which is least traded and you will be successful. And I will close my talk by giving a small story. I'll give a small story, and I used to enjoy that story. And I'll end my talk with that story. That I'm sure all of you must have read the story of Helen of Troy. And anybody reads all these books? Can we put on the lights, please? Turn on the lights. You people read said books, Helen of Troy? Yes or no? Yes. Do you remember one instance? You know, Achilles, his mother was a goddess. And when the war breaks out, Achilles was a big warrior. And he was always successful. Wherever he went, he was successful. So they approached him to join the war. And by that time he was married, he had 2 children. So he talks to his goddess mother Zeus. He says, Mother, should I join the war? Should I go and fight the war? The mother says, look here, Achilles, you are married, you've got a beautiful wife, you've got 2 children. And then you will have 2 grandchildren or 4 grandchildren. You will be remembered only up to the level when your grandchildren are born. But if you go to war, I see you will die. It's written in your horoscope, you will die. But then you will be remembered for thousands of years. And Achilles went and fought the war. He died because Paris hits the arrow on his ankle. That's why it is called as the Achilles heel. And he dies. But today Achilles is remembered for everything because he went and did something. He gave luxuries. Went and did something which otherwise many people will not do because they are all dead. They are all deep into the luxury. So I think this is my message to you, that please do something different, you will be successful. Thank you very much.